Welcome, everyone. It's so great to see you all here today. My name is Isa, she, her, hers. I am MOLA's current program manager. So I work very closely with our scholars, our scholarship program, our mentorship program as well, and our programmatic committees that are more of like leadership pathways for MOLA, which we can talk more about. We're so excited that y'all are here today because you're interested in applying to our scholarship program or MOLA MRF Scholars. So hopefully after this session, you'll be more familiar with the program, with the application, and get all of your questions answered. All right, so who are we? Who is MOLA as an organization? So our organization was founded in 2017 by two physicians, one of them Dr. Pilar Ortega, who we set up a scholarship program as well for our scholars. So one scholar is usually selected as the Pilar Ortega MD scholarship recipient at the end of the program. It was Dr. Ortega alongside a surgeon and a public health expert who founded MOLA in 2017. Originally Chicago-based organization with the goal of increasing representation in the field of medicine and healthcare professions in general. So really focusing on programs that help students get to that point of becoming healthcare professionals. And for healthcare professionals, really looking at, well, what we can do, how we can establish a community so that they're able to thrive in their careers and feel that connection to their community and to their careers, of course. Originally, we started off in Chicago, but then slowly started to expand more to the Midwest area. So we have a chapter in Wisconsin, and then slowly now starting to expand a little bit more nationally. I don't know how many of y'all were able to join us at our conference in Texas this year. It was the first time that we hosted a conference outside of Chicago, which was very exciting. So, yeah. And just a quick kind of overview of our conference. So we do host an annual conference for MOLA every year. And it started off as a symposium, but then we grew the symposium so much that we decided to label it as a conference. And that usually happens in October. And that's where we feature a lot of our scholars, their work. We have different sessions, different tracks related to health equity, to immigrant health, cancer disparities, etc. Really listening to what our members want from the conference and the type of lectures and kind of educational opportunities that they need from a national conference like the one that we host in October. We have supported many mentees and scholars since our founding of many different healthcare fields. And I think that's the beauty, one of the beauties of both our mentorship and our scholarship program and just the organization as a whole is that we attract different healthcare students and healthcare professionals, which makes it very unique. So it's not just focused on students interested in medical school, but we also have pathways for students interested in, for example, like physician assistant or being a nurse or public health experts. And I think that's what really makes MOLA unique is that we are able to work with these range of healthcare field and professionals and really allowing for our mentorship and scholarship program to thrive through that way. Our scholarship program is in connection with the Michael Reese Research and Education Foundation. So that's why a huge portion of our scholarship program is really focused and highlights research and the importance of research in medicine and specifically when it comes to health equity and promoting health equity. 90 scholars and mentees were all across the US. So again, it's focusing on that national expansion that really also makes highlights the growth of our organization that originally started in Chicago and then slowly started to grow. And we usually host events either in person or virtually. And a couple of I see our mentees here, mentors. They can talk more about this if, in the chat if you want, highlighting our academic pathways. That's one way that we kind of promote these community events. Through our academic pathways, it's part of our mentorship program where we have like different lecture series around twice a month, a little more sometimes or a little less, depending on the month. but definitely highlighting what our students want to hear. So if they're interested, let's say in geriatrics, we invite a physician who is part of MOLA, who is a geriatric specialist, and then they talk about that. So it's really made and focused by our students, our mentees, and our mentors who let us know what they're interested in. And it's very similar for scholars as well. Usually the bulk of the program is done in the summer, and they have different lectures as well. I believe a Saturday check-in, which Dr. Bonilla can talk more about. And during this check-in, we have different lectures related to research and kind of the ethics of research or any sort of like specifics that our students are interested in hearing about, especially for our students that are newer to research. And just a little bit more on our membership. You can see the highlighted states are where our members are at. So they're kind of everywhere in the different fields that are represented in through MOLA. So as you can see, it really goes beyond just that MD. All right, and then just a very kind of broad overview of the scholarship program, and then I can hand it off to Dr. Bonilla. So 58 scholars have graduated from our program, and I think that's more. I don't think we've factored in this last cohort. They all have been assigned mentors, and it's around 18 to 21 mentors that we have in total that are so kind and are able to provide their time to mentor our amazing scholars. Two faculty scholars who kind of lead the scholarship program. So, for example, Dr. Bonilla is our current faculty scholar, but for this upcoming cohort, it will be a new faculty scholar, and that faculty scholar has that position for 2 years. So, really, that's like the main mentor in the sense of any questions that come up about the scholarship program or about your research specific that maybe your mentor can't answer. That's what that faculty scholar is there for, to kind of guide you through our program process. And very, very kind donation and sponsorship by the Michael Reese Foundation. A total of around $285,000 have been handed to our scholars since the very beginning of our scholarship program. So this is definitely one of the strengths of MOLA is our scholarship program. And we have academic institution affiliations throughout the nation, of course, very strong in Chicago and in Illinois. But again, that's what makes us such a strong organization because we kind of have that connection all over the US. So our scholars are everywhere. They're not just based in Chicago. So if you're not in Chicago or if you're not in the Midwest or in the Illinois area, you should definitely still apply and you can still apply. All right, and I will go ahead and stop here and hand it off to Dr. Bonilla to kind of talk more about his experience in working with the scholars and what we look for in our applicants.
Thank you, Isa. Well, hi everyone. I'm not sure what's everyone kind of like level of education if you are already in med school or not. But there's the scholars program. It looks for we're looking for medical students or from other specialties to PAs, MPs, who are actually trying to get it into more of an academic career long term. Ideally, that's what we would love to have candidates look for a career in academics, right? Where the representation for Latinos is very low. Um, Ideally, we will want you guys to have a research project at your at your home institution, and then we kind of support you from there, guiding you towards the process for your research. Uh, and we do like weekly check-ins during the summer just to kind of troubleshoot if there's any issues going on with your research. We will pair you with a MOLA mentor that will be different than your institutional mentor. The purpose of the MOLA mentor is to have someone, if at your institution is not of a Latino background, then you have a mentor who's from Latino background, and that's the purpose of the MOLA mentor. Someone to help you, going through that experience of research as a Latinx. Um, The meetings are weekly. Yes, there's 12 weekly Saturdays that we meet during the summer, usually somewhere, and correct me if I'm wrong, Isa, somewhere between July and like end of September or October at times. Um, there's a attendance, right? So you need to commit to coming to at least 85% or more of those meetings. And the meetings are different every Saturday, right? There's meetings that, as Isa said, we will have lectures. And on those lectures, there's going to be a speaker, and it's like a formal lecture. And those lectures are research based. Could be from, as Isa said, ethics up to how to submit an IRB, or how to get published, or how to get my research out there and be known by the scientific community. So there's various type of lectures, and every year is a little bit different than the prior year. And for the rest of the meetings, when we don't have a lecture, it's kind of like a check-in, um, basically a talk between you, me, and your rest of the Schola cohort, the MOLA cohort, and then we just kind of like troubleshooting among ourselves, right? If one of you have a problem with let's say, how to run an instrument or how to run certain statistics, then another of you might have experience doing that. So that's kind of like the nice thing about this. Everyone becomes a family and a community, and we're supporting each other and trying to succeed, and trying to make you succeed and have your research published. In prior years, in the past 2 years, I think that we have had all of you, all of the 11 scholars to have a poster and present during our conference. Out of the 22 scholars that have been in charge these past 2 years, I think that around three or four are published now, which is great. And publications are from basic science. We had a scholar 2 years that was doing basic science in dermatology and got published in Nature Reviews, which is one of the highest journals. And then we have other type of publications when it comes to language concordance. And there's different more. We have also clinical projects, right? People looking into chronic kidney disease, looking into folic acid for pregnancy and whatnot. So there's different type of specialties, even if you're not going into a medicine specialty, if you're going into surgery or that's what you like, we support that too. So it's not necessary have to be surgery or medicine. We also support PEDS, GYN, and if you're doing a master in public health, also we had a scholar who was doing an MD and an MBA at the same time. So I think that whatever is your interest, the key is to have a project idea already by the time that you're applying, because you have to talk to us about that, right? That's part of your screening and it's part of the interview process. What is your research project and what are you going to do during this time that you're going to be a MOLA scholar? So I think that if you have a research project and then you have an institutional mentor, um, that's fantastic. And that's basically what we're looking for. Yeah, I don't know if there's anything else, Isa, that you want me to talk about.
I don't think so, Dr. Bonilla. I think, well, maybe just highlighting also mentorship and how that works in our scholarship program. I've been getting a couple of questions in my DMs wondering if you already have to have a mentor coming into the scholars program or if that's even a factor that's considered in the process of selecting the scholar.
Yeah, so you should, if you're doing research, right? If you're gonna come with a project, ideally we will want you to have a lead PI or investigator, right? Someone, a mentor at your institution. There's has been cases where we didn't have we when we have great applicants, right? That they were selected, and for some reason they lost their institutional mentor or they did not have a mentor, then we try to look for a mentor at your institution, but it becomes a little difficult at times since we're having scholars not only from Chicago, but only from outside Illinois. And then, having connections and trying to reach out to people becomes a little bit difficult, but we have been able to find mentors for those great candidates that did not have an institutional mentor. So I will say it's definitely not something that is gonna put your application in the back. But if you already have an institutional mentor, that's probably gonna push your application a little bit more.
Perfect. Thank you so much, Dr. Bonilla. And let me just look through my DMs. Yeah, and then I keep getting similar questions of whether the PI has to be from the same institution and if the PI has to be kind of associated with the same kind of project, the same specialty as the project, or if it can be different and from a different institution.
Hmm. When it's from a different institution, it becomes a little difficult because if you're doing a research project, you're gonna need an IRB. Um, so if you're doing a research project, I think I find it really hard for you to have someone from a different institution kind of like doing this type of research with you. Uh, It becomes a little more difficult since some institutions have certain restrictions or need, for example, a data use agreement, and you need to share data between institutions. So it becomes a little more complicated. I will say it's not impossible, but I think that best case will be to have someone physically or locally where you are doing the research project.
Yes, absolutely. And then just also wondering if you have any kind of last minute, or last words of advice for the people who are currently applying at the moment as they finalize their scholarship application. Anything else that you kind of recommend or suggest to our scholars before we
Yeah, I think.
transition us to that application overview?
Mhm. I think that, in the era of ChatGPT, I would be very careful when you're doing your letter of interest. Uh, I'm not saying that it's wrong to use ChatGPT. You can use it to like um, get some ideas or an outline for your letter of interest or your research or whatever. But make sure that you're reading over that, personalizing it, making it yours, right? Because uh, I think we can tell when we're reviewing applications, someone who's genuine, someone who's honest, and is sharing a personal experience, and that kind of makes a connection with one of us or a couple of us, and that's how we push your application through the rest, right? We get many applications that are fantastic, and all of you guys are doing great things. All of you are doing research already, probably, and have experience in this type of field. And I think that just think about what will separate you from the rest, right? What's unique for Adriana Gutierrez, right? And once and then once you get into that interview, just be yourself. We want scholars to be highly motivated. We want you to make us feel that motivation and that you are here to learn and that you want to, most importantly, benefit our Latinx community. Thank you.
Very well said, Dr. Bonilla. Thank you so much. We so appreciate you being here and for that advice. Okay, everyone. So I do want to be mindful of time and give y'all plenty of time to connect with our alumni scholars. But I just want to do a brief kind of overview as to what students have said who have been part of our scholars program. So as you can see here, many agreed that being part of the program and that opportunity to present their work at our conference really helped those presentation and oral skills that are so important in really any career that you choose, especially if it's a career in the healthcare field. it improved their academic writing skills because you will have to convey that information and results of any research that you do through your abstract, through your presentation, by having those conversations with your mentors as well, and just with the audience as you present in our conference. And you can see all the other data here of the program. Kind of at one of the valuable part and components of the program is that individualized mentorship as well. And then regarding community outcomes, it really allowed students to kind of think of their future careers and how they can incorporate different health disparities work and working with Latinx communities into their future research as well. Many of our students, this was probably the first time for a lot of our students that they were able to kind of take the lead on a research project. So it really allowed them to gain that exposure, that essential exposure to how research is conducted when you're kind of the person thinking of that research project. And many of our students have agreed that being part of the program kind of like better allowed them to advocate for their community through research. If there is something that you're interested in and focusing on in your research project that is a health disparity, for example, then that's one way that you can kind of include advocacy in research as well, which maybe some people can't make that connection between research and advocacy, but through our scholarship program and because it's specifically for our LHS plus speaking students. That's one of the ways that, you can incorporate advocacy into your work. And then just, other research or outcomes that we have from our program that students were able to present at the MOLA symposium, that 57% of our students were able to publish the work that they do. You get a lot of guided mentorship through the program. So really taking advantage of that opportunity to publish your work, to get your work out there beyond just presenting at our conference. And we highly encourage that. And just, a couple of statements from our students who are now alumni of the Scholars Program. All right, let me go ahead and stop sharing, and then we can go over the application just very briefly because I do want to give plenty of time for y'all to ask questions. And yes, this session is being recorded, and this recording will be available on our website. And it will also be emailed. Okay, let me pull up the application here. Okay. So first things first, I do suggest that one of the requirements to apply to the program is to become a member of MOLA. So if you're not already, please become a member of the organization. This is our membership application and it's free for students and everyone gets accepted. So it's not like it's we go through the applications or something. So become a member. That is one of the requirements for our scholarship. Now, just an overview of the eligibility criteria to be part of our scholars program. You do have to be of Hispanic and Latinx heritage, interest in pursuing a health career. And again, this goes beyond medical school. And Adriana perfectly highlights this. So Adriana is an IMG from Peru, and she's currently pursuing an MPH at Emory University. So that's one example of, kind of like going beyond medical schools for students that are pursuing graduate programs in different healthcare fields. Please know that, you're still eligible to apply. Uh, Demonstrated interest in service to the Hispanic and Latinx community. And again, you must be currently pursuing higher education. This includes from undergrad and up. So if you're in a transition phase between like graduating from undergrad and about to start a graduate program or about to start a graduate program and maybe you've taken some time off, you're still eligible as long as you're starting a grad program or you're currently involved in a grad program at the moment. So for students who are taking gap years and are not in school and are not students, then unfortunately you cannot apply. But feel free to apply once you are matriculating into a graduate program. And of course, demonstrated financial need. I think the most basic component of the scholarship program is, of course, that financial need. It's a scholarship at the end of the day. But again, it's a program that goes beyond just meeting that financial need and really, allowing students to become familiar with the research process, with conducting their own research projects themselves. And again, special attention will be given to students who have been involved with our MOLA mentorship program, and this includes beyond this cohort. So if at any point in the past you were involved with our mentorship program, please let us know. In the application, there's a question that specifically asks you if you've been involved with our mentorship program, and they can just select yes and then the cohort year, just so that we can verify that information. And just keeping that in mind is, and this applies more to the students who are not applying this cycle, but are thinking of applying to the next cycle of our application. Our mentorship program application opens around, I would say, end of March. No, probably beginning of March, and then we select the cohort in April. So if you are interested in applying to our scholarship program in the future, please apply to our mentorship program so that way you will be considered favorably for our scholarship program. All right. And then we can go over the logistics of the scholarship application. I'm just going to breeze through this information, but if anyone has any questions that's specific to our application, please let me know in the chat. All right, so the application for your application to be completed, it requires two parts. So one is completion of this form of this application and submitting the supporting documentation. Then we can go over that information. So, writing your email and then general demographics, first name, last name, date of birth, phone number, address, city, state, zip code. And this information, we use it more to just get a general sense of where scholars are located for each cohort and how our program is expanding. Race and ethnicity. And this is a question. If you've ever been involved with MOLA's mentorship program, either as a mentee or a mentor, and if yes, which cohort? And then education. And remember, you must currently identify as a student or be matriculating into grad school. Um, oh, and perfect. And Dr. Moreira has joined. So actually, I can pause here and Dr. Moreira, thank you so much for joining us. Dr. Moreira currently serves as the president of our organization. And Dr. Moreira, I was just wondering if you can maybe, share a few words on what, you know, kind of the growth that you've seen with our scholars program, and especially what we look for in the application of our
Sure.
of our scholars.
Thank you, Isa, and thank you to you and Dr. Winia for holding down the fort. My apologies, everybody. I just got off a plane earlier this afternoon from a conference in Florida, so I think I had overestimated the ability of the gap between getting off the plane at O'Hare and jumping on this conference. So I'm Dr. Jonathan Wadida, Associate Professor of Medicine at the Feinberg School of Medicine at Northwestern. My focus is on stem cell transplantation for um, blood cancers, and I also focus on T-cell lymphoma. So I'm a hematologist oncologist. And as Isa had mentioned, I'm the president of MOLA. I've been in this, it's a 2-year term, and it's about halfway through my first term. And I've actually been the chair of the scholarship subcommittee for quite some time. And so just to build on what Isa, I'm sure, has provided, let me start off with telling you about the MOLA Scholars Program or MOLA MRF Scholars Program. And then Isa, have we had a chance to talk a little bit about what MOLA is?
Yes, but
Okay,
feel free to
perfect.
go over that as well, from your
Okay.
perspective as
No,
president.
that's okay. I don't want to be redundant so that there's ample time for questions if anybody has any. So the MOLA Micro Scholars Program has been around almost since shortly after MOLA's inception. The basic premise here is recognizing the paucity of LHS plus scholars in academic medicine, in healthcare in general, right? So looking to broaden the amount of research that's being conducted in our communities, on our patients, on the health inequities and the barriers to equitable health that marginalized communities face. This is really what kind of inspired that. And the premise is if we can engage students like yourselves to start thinking about addressing the needs of marginalized communities, thinking about research projects that really hopefully give us insights as to the origins of these barriers and how we can dismantle them. That one day all of you can be physician scholars or healthcare professional scholars with a focus on helping overcome or dismantle these barriers, and maybe also mentoring the next generation of students that come after you. So what we've done is paired students with MOLA scholars, I'm sorry, MOLA members that serve as mentors. And as Isa was going through the scholarship application process, we ask you to propose a project. It doesn't have to be something super detailed. We recognize that many of you, or most of you, are probably in medical school. Some of you are in other health professions programs, and maybe some of you are undergraduates as well. And so this does not have to be a very, very extensive research proposal, but we'd like to gauge a little bit more about what you're thinking about and what kind of project you'd like to do. That helps us understand what MOLA member may serve as a good mentor for you. The Scholars Program has been supported by the Michael Reese Foundation. For those of you that are not native to Chicago, even those of you that are, the Michael Reese Foundation is actually a foundation set up by the leadership of Michael Reese Hospital, which is a now shuttered hospital here in Chicago, but they've been extraordinarily generous and really have supported our vision since the inception of this program. And so we have had scholars initially coming from the Chicago area, but as each subsequent year has gone on, as more word of mouth has spread, and as our scholars have gone on to graduate from medical school or graduate from their health professions programs and actually start going into residencies, fellowships, or into the work field, I think it's also helped them come around and really spread the word as to what this is and what we're doing. So, what really makes a successful scholar is having, even if it isn't a well thought out or very, very detailed project, having somebody that's really passionate about this and ideally having a mentor at your home institution that can really augment or complement what the MOLA mentor is going to be doing as well. So it doesn't have to be basic or translational research. We have had some scholars that have done basic research projects and they've been very successful. Most of our scholars are looking at health disparities or outcomes research or survivorship research. And it can be in oncology, it can be in cardiology, it can be in primary care. It can be in medical education. We've had a lot of scholars that have actually focused a lot of energy and effort on medical Spanish and the implications of creating more robust medical Spanish curriculums or medical Spanish in the healthcare setting, right? And having language and cultural concordance and its impact on health outcomes. So I think what I would stress to all of you, and I see some of you that have been past scholars, you can probably attest to this as well. The key here is making sure that you are ready, passionate, engaged, willing to do the work that is required of this, because I also want to be clear. Um, the requirement of this project is of this program is to actually have a project that you can present, results that you can present at our MOLA conference towards the end of the year, sometime in October. Identifying a mentor at your program, at your home institution is not an absolute requirement, but I think it is strongly recommended to augment the MOLA mentor that you'll be assigned. And really being interested and eager in thinking about how scholarship and how academia can really complement your role as a future healthcare professional, and bringing that excitement and that enthusiasm to engage with the co-scholars that you're going to have because you'll be interfacing with them a lot. Many of you maybe will be scholars that we select, and maybe you're seeing some of the people that will be part of your cohort. And so this becomes a network for you as well to lean on, to run ideas by, and you never know, you might cross paths in the future as well beyond the MOLA MRF Scholars Program. Isa, Dr.Wania, let me know if I missed any details